Hi everyone, my name's Jag and I want to talk to you today about the population health needs that are present in our societies and our communities, and also the role that social prescribing has to play in addressing these needs. So when we try to understand and analyse the main health improvement needs and opportunities in your geography and also in other geographies across the country, we've used primary care data to help us build our picture, and we've triangulated that with other academic research. And often what we find when we start this analysis is that a particular area thinks that they're unique, or their population health needs are unique. And of course areas are unique, but generally when we do this analysis we find these four themes always come to the fore. And I'll just step through each of these in turn. So when we're talking about obesity, we're really talking about diabetes and obesity, so diabesity. And in an average population, an average PCN, we find that about just shy of 50% of people are overweight, so with a BMI of over 25. And of course that can vary, but that number is always a very high percentage. When we're talking about anxiety, we find from the GP practice records that over or around 30, 35%, 37% of patients have some sort of mental health need code on their record. That could be low level of anxiety or more serious mental health illness. When we're talking about frailty, whilst the percentage of people in an average population are not frail or do not have a frailty need, we do know two things: that we've got an aging population, and we also know that supporting patients who are mild and moderately frail with holistic support can really slow the progression towards severe frailty. And there is also some new research that indicates that frailty can even be reversed. And then finally, when it comes to respiratory, we know from the data that we've seen that around 30% of patients have some sort of respiratory need, whether they smoke, they have COPD, they have asthma, and of course air pollution is a key population health need and improvement area as well. So to summarise, the area is unique, but these four themes are needs across every area across the country, as well as nationally and internationally. And you don't really need to look at lots of data to help you determine what the needs are in your population. You can stick to one of these and ideally find or proactively find patients who touch on a number of these areas, and that'll get you off to a good start. And the final thing to say is, and I'll come on to this in a little bit more detail, is that by looking at these needs in your population, it almost immediately become clear about how important the role of social prescribing is in starting to unpick these needs. So far we've covered what the main population health improvement needs are in your area and all areas across the country. And hopefully those themes that are coming out from the data chime with what your instincts are telling you, or what you're seeing when you see people face to face. What we want to do next is try to establish a link between what's good for our patients and our populations, and what's also good to stem rising demand across primary care, secondary care, and other providers in a local health community. And so what this chart is trying to do is provide some data to start establishing that link. So the chart is a chart that has BMI on the x-axis, and then it's got the number of GP appointments on the y-axis. And often we're presenting this analysis in a primary care setting, but you could change that y-axis to contacts with any provider. And what the chart is showing you is that as BMI rises for patients, contacts rise as well. Now this is a very simple bit of analysis, and we've done more complex analysis to really establish the link between BMI, anxiety, respiratory and frailty, and rising demand. But hopefully what this shows you is that it's a very clear trend upwards, and even within the healthy range, per point increases in BMI correspond to rises in demand. Obese patients have nearly double the number of GP contacts. Anxious patients also have nearly double the number of GP contacts. And the same can be said of frailty and respiratory. So generally what we're seeing here is when we do a series of things to help our patients stay healthy, we are inherently doing a series of things that are probably the best things to stem rising demand for our services. So we've covered the main health needs in your population, and we've established a hard link between addressing health needs and reducing growing demand. So what role does social prescribing have to play in all of this? And so I want to cover two bits of evidence. One that's specific, based on a pilot, and that's the slide you see in front of you. And the other that is more general, that's based on lots of data that we've gathered from your own social prescribing service in Kirklees. So this slide covered an in-depth pilot looking at a small number of patients who received dedicated social prescribing support. We identified these patients based on their primary care record. So they weren't referred into the service, they were proactively found using their data. And the initial support offer discovered that these patients did need physical health support, mental health support, social health support, housing, employment and financial support as well. The social prescribing team provided this support, and the slide lists some of the benefits that patients saw, including reduced BMI, increased self-esteem, reduced social isolation and loneliness, reduced inequity, and finally people felt more connected to their communities. So the big headlines here are that these people increased their physical activity, they saw their well-being improve, and critically, patients felt more able to manage their health and well-being. And I'll talk a little bit more about why that's such an important measure at the end of the presentation. So when we look at those main health themes around obesity and anxiety, we can see clearly that social prescribing is addressing the key levers that people need to start taking better care of themselves to improve their well-being and manage their physical health better. So the previous slide looked at the impact of social prescribing on a small group of patients, specifically on well-being and activity. And those results probably chime with what you're seeing when you look at your services and you hear about those patient stories anecdotally. What this slide is doing is looking at more aggregate data over a longer period. So we've used data from the primary care record to look at people who had social prescribing a year ago and then study what's happened to them. And what we can see when we do this analysis is that, and the sample size for this piece of work is hundreds of patients, we can see that these patients have fewer GP contacts, about 13% less, and significantly they have much slower growth in GP demand as well. So what we know, on average, GP demand is growing at about 5% a year, but yet patients who've had social prescribing support, their growth is much slower than the average. We also know from the primary care record that these patients have a lower BMI by a factor of about 10%. And then finally, using what is often quite poorly coded hospital data on the primary care record, so this is just an indication, we can also see that there's a strong link to lower hospital admissions for social prescribing, but that needs to come with a bit of a caveat because the data isn't perfect in the primary care system. So linking this to the previous piece of work, so what we can see is that on a per patient level, we're clearly seeing a benefit, and that's measurable. And then when we look at this level, we can see that those benefits are translating into better health and lower demand. And of course, we need to do more and more work to study this, and specifically, we will develop this piece of work that you see on your slide to build it out and make it more robust. The chart on this slide is not for Kirklees, it's from a different system, but it's a useful point of reference. And what that chart shows is that the more times a patient sees a social prescriber, the bigger the drop in their GP demand the year afterwards, to the point where a patient sees a social prescriber 3 times, they see a drop in their GP contacts of about 3.5, so more than the number of times the patient saw the social prescriber. Now, the reason why I've included that is that it's quite interesting from a return on investment perspective, because if we're able to start to show that when a patient sees a social prescriber, the saving in GP appointments alone more than kind of pays for itself, the social prescribing pays for itself just on that alone, and the other benefits in terms of health, reduced contacts with other providers are just additional benefits in a way, then we're really onto something quite exciting here in terms of measuring the impact of social prescribing and also investing in it in the future. So hopefully we've established now a really clear and compelling link between social prescribing and how it's effective at addressing some of the biggest health needs that our populations face. So the final concept I want to touch on is one around health confidence, and this really strikes at why social prescribing has such a big impact. Now, we often see these terms used interchangeably. You might have heard the term patient activation, health confidence, of course, self-efficacy, but ultimately they all mean the same thing, and that is about a person's ability to manage their own health and well-being themselves. Now, when we look at the range of different interventions, not just social prescribing, but other things like health coaching, practice nursing, giving lifestyle support in existing consultations, care planning, all of those interventions have an impact on population health. And they might seem different on the face of it, but ultimately they all employ some of the same characteristics. And at the heart of those interventions is a personalized motivational interviewing style or technique. So self-efficacy sits at the heart of each one of those different interventions, which makes it really important. It's really the catalyst to improving population health. So I just want to go through a list of reasons, specific reasons why this is such a key concept. The first is by finding out from patients what their health confidence is like, either with a full questionnaire or a simple question as you see on the slide. The first thing it lets you do, it lets you build a better intervention for that patient. If somebody's very able at managing their health but still have health needs, a digital app might be beneficial to them. If somebody's not able to manage their health but have health needs, it's likely they're going to need more face-to-face support and a stronger relationship behind them. So, and of course, by capturing this information, it also helps you in aggregate because it lets you segment your patients for different kinds of support and different care pathways as well. So the second reason why asking this question is such a good idea is that it can often change the shape of the conversation. So in its own right, it can act as a nudge. So we're encouraging GPs to ask this question so they can start to add a little bit of motivational behavioral change in an existing contact. But of course, this sits at the heart of what social prescribers and health coaches do anyway. So it can act as a nudge and it can change the shape of a conversation. The third reason why this is important to capture is because it lets us turn the improvement cycle a little bit quicker. So what we often see is we don't need to wait after we've delivered an intervention for GP contacts to fall or for health to improve, because patient activation or health confidence will change first. So once that changes, we can measure that change and even quantify the likely change in GP contacts or the likely improvement in health. So this gives us a more real-time measure as to whether what we're doing is working or not working. So the third reason why this is important is about measuring quickly. And then the fourth and probably final reason is that what we do see with some social prescribing teams across the country is that they become a stopgap and case lists grow because patients create a dependency on the social prescribing service and the relationship they've built with a social prescriber. But by focusing on self-efficacy from the start, you're able to move patients who arrive on your case list off your case list and then move through supporting your population. So there are a few reasons why health confidence is so crucial. So to conclude everything we know so far, the interventions that have the biggest impact on our populations, and when we talk about impact, we're talking about impact on people and impact on demand, are ones that help us move, eat better, sleep better, and connect with ourselves and others to improve our mental health. And clearly social prescribing is an intervention that can help people do all four of those things and support them on that journey over a period of time. So this is what we know so far, and hopefully this provides a useful summary of everything we've learned. And we're clearly going to learn a lot more about the specific things that we need to do and say with our patients to really amplify the benefits for them. So I think this is just the beginning of a journey, of a really exciting journey. And then finally, and this is probably a message for those who aren't involved in social prescribing, but what we say is, if you just want to get started with the limited time and energy that you have, just starting to ask people around their health confidence and measuring it is a great way to begin. Thank you.